I'm trying to integrate all the subjects like pharmacology, pathology, microbiology, medicine, pediatrics, surgery as far as GI is concerned. So it is an integrated approach to solve rapid fire MCQ questions. So starting with the gastrointestinal system in an integrated manner, the first question is commonest site of peptic ulcer. Before going to solve this question, we must know that peptic ulcer can occur in the stomach as well as duodenum. Many students think that the stomach can't have ulcers because it has a thick leather wall. It is wrong. Stomach also can have ulcers, but in the antrum part. So the commonest sites in the decreasing frequency are, this is the commonest to least common. The commonest one, duodenum, first part of the intestine or the first part of the duodenum, followed by stomach, that is antrum, followed by gastroesophageal junction in the cases of GERD disease. So if the question is asked in patients of GERD disease, the commonest site where the ulcer can occur, the answer will be gastroesophageal junction, not duodenum and stomach. But if the general question is, are the commonest site, will be first part of duodenum, followed by the stomach antrum, and followed by the gastroesophageal junction in the case of GERD disease. Then we must know all other sites also, which are less common, but we must know it is margins of gastrojejunostomy, followed by the patients of Zollinger-Ellison syndrome in stomach, duodenum or jejunum, and last one in the Michel's diverticulum. So the commonest site of peptic ulcer, answer is A, the first part of the duodenum. Next question, Helicobacter pylori is not associated with. To solve this question, we must know that the H. pylori is a gram-negative, very fast moving bacteria which lives in the stomach. Why it lives in the stomach despite a heavy amount of hydrochloric acid in the stomach? Because it has a very fast motility first, and it is surrounded by heavy amount of mucus which is secreted by the cells of the stomach mucosa. So these are the two factors, mucus and motility, why H. pylori can survive in the stomach mucosa. Now, the diseases which H. pylori causes is duodenal ulcer, followed by the gastric ulcer, superficial gastritis, chronic atrophic gastritis, gastric adenocarcinoma, MALT, and GERD. Now, GERD is very less common, or you can say rare, in the patients of H. pylori, but it is 100% associated, because there are many students which are saying that in the patients of GERD, H. pylori infections are not associated. It's wrong. In GERD patients, there are also chances of H. pylori infection, but it is in the lowest part. This is the least common part. Next is endoscopic biopsy. In the case of H. pylori related duodenal ulcer is most likely to reveal. We have already studied. So here the answer will be antral predominant gastritis. So presence of antral predominant gastritis is associated with duodenal ulcer formation. So again we come to the question, endoscopic biopsy from a case of H. pylori positive duodenal ulcer patient, the most likely to reveal in the diagnostic slide, answer is antral predominant gastritis. H. pylori is known to cause all of the following. So again, going into the detail of H. pylori, gastritis due to H. pylori is predominantly antral, not fundal. It is antral, not fundal. Antral gastritis is associated with duodenal ulcer formation, and gastritis involving the corpus is seen, that is predisposes to gastric cancer, gastric atrophy, and gastric ulcer. This means that H. pylori causes gastric ulcer, yes, duodenal ulcer, yes, gastric lymphoma, yes, but not fundal atrophic gastritis. What it causes is antral gastritis. We have already discussed in the previous slide. So this is antral gastritis, chronic superficial gastritis leading to chronic atrophic gastritis, which is the antrum part. So it is antral predominant gastritis. This is the most likely feature of H. pylori infection. Now, diagnostic steps for H. pylori include all the following. Urea breath test, yes. Rapid urease test, yes. Gastric biopsy, yes. SAFA test. No, SAFA test is not done for the H. pylori infection. H. pylori infection, because SAFA test is done for the diagnosis of ocular tuberculosis. So it is a soluble antigen fluorescent antibody test which is done for tuberculosis in the case of ocular tuberculosis. Now, in studying in detail, urea breath test is done by the gastroenterologist in the OPD level. Urea breath test. Rapid urease test is done by doing the endoscopy, taking out the juice of the stomach and then performing the urease test. And the last one is gastric biopsy, and of course the biopsy can be a gold standard test for the H. pylori. Now, if the epidemiological studies investigation of choice is asked, epidemiological studies of H. pylori are done by using, answer will be serological markers, because in epidemiology what happens, we have to study large number of population in a small span of time. That is why we can't use urease test, we can't use the biopsy, we have to use a serum test which can done in a very large area in a small span of time by performing ELISA. So that is why ELISA is a serological test, and epidemiological studies of H. pylori are done by using, answer is serological markers or ELISA. Coming to the next question, which of the following is false? So regarding H. pylori, so in H. pylori we know that H. pylori infection remains lifelong if it is untreated. So it must be treated. The treatment of choice is clarithromycin, bismuth, which we will discuss in the coming slide. Endoscopy is diagnostic because we can perform the urease test. Toxigenic strains causes ulcer. We have already discussed in the previous slide that the H. pylori infections first of all causes gastritis and later on causes adenocarcinoma. So these are three true. So which is not true is answer chronic infection urease breath test syndrome negative. This means that the answer is A, because urease breath test detects H. pylori infection by the bacterial urease activity and remains positive till the bacteria has not been eradicated. Thus, urease breath test becomes negative only after the eradication of the bacteria. So, which of the following is false regarding H. pylori? Here they are saying that with chronic infection, urease breath test becomes negative. It can't become negative because it's a chronic infection. So all chronic infections of H. pylori peptic ulcer are H. pylori positive. They are not negative unless they are eradicated by the help of clarithromycin bismuth salts. So this is wrong and these three are correct. Next question, all are true regarding H. pylori. So regarding H. pylori, we must know few more points. That the prevalence of H. pylori is 30% in the developed and 80% in the developing countries. Also already told you, is a very motile bacteria. It's a spiral bacteria, flagellated bacteria, GNB gram negative, and the urea test is very important and simple test which is performed at the OPD level. So the true are toxigenic strains causes ulcer, yes. Later on causes adenocarcinoma, yes. Urea breath test is positive, yes. GNB gram negative organism, yes. So answer is less prevalent in developing countries, wrong. So answer is less prevalent is wrong in this case because it's very prevalent in developing countries, more than 80% in our country India and 30% in developed countries. Next question, which of the following statements about peptic ulcer is true? Answer is B. The incidence of complications has remained unchanged. Before going to the question, we must know the following points to solve this question. This H. pylori eradication is very important because if the H. pylori is not eradicated, it can cause gastritis, later cancer. So H. pylori eradicates, reduces the chances of recurrence of gastritis and cancer, and after successful eradication of H. pylori with antibiotics, ulcer recurrence rates are reduced dramatically to 5% in a year. So it is very important to treat H. pylori positive patients of peptic ulcer, and the test can be done at the OPD level by breath test, urease test, or biopsy or even by the ELISA. So which of the following statements about peptic ulcer is true? They are saying Helicobacter pylori eradication increases the likelihood of occurrence of complication. No, this is wrong. The incidence of Helicobacter pylori in India is very low. No, it's very high. Helicobacter pylori eradication does not alter the recurrence ratio. Wrong, it alters the recurrence ratio. Here is the recurrence ratio. Again, I will reading this. After successful eradication of H. pylori with antibiotics, ulcer recurrence rates are reduced to 5% in a year. So, answer will be B. The incidence of complications has remained unchanged. Next question. Which drug is not effective against H. pylori? We have already discussed that in H. pylori we use metronidazole, amoxicillin, clarithromycin and bismuth. So not used is erythromycin. Next question. All are used in treatment of H. pylori except bismuth, yes; clarithromycin, yes; metrogel, yes; or metronidazole, yes; cisapride, no. Cisapride is used to treat gastric motility disorder, not for the eradication of H. pylori. In gastric outlet obstruction in a peptic ulcer patient, the site of obstruction is antrum, duodenum, pylorus, pyloric antrum. Now, before solving this question, we must know that gastric outlet obstruction in a patient with peptic ulcer is suggestive of pyloric stenosis, which we study in surgery. The term pyloric stenosis is a misnomer term. Why? The stenosis is seldom at the pylorus. So, pylorus stenosis is not seen, seldom. So, it is a misnomer term. So, commonly the stenosis is found in the first part of the duodenum, not at the pyloric part. So, the most common site of the peptic ulcer. So, in gastric outlet obstruction peptic ulcer patient, the site of obstruction is duodenum. Next question.